Welcome to the Functional Medicine Doc Talk podcast. I'm your host, Dr. Kurt Woeller, talking with experts in functional and integrative health and medicine, discussing critical information for improving your health and wellness to help you live a long, full life. Let's get to it. Hi, this is Dr. Kurt Woeller. In this episode, I have a conversation with Nicole Bell. Nicole is the current CEO of Galaxy Diagnostics, which is a laboratory company that is focused on improving the accuracy of detection of tick-borne infections. She is an author, entrepreneur, and an advocate for individuals suffering from tick-borne illnesses, and specifically helping individuals understand the complexity and the reality of neurodegenerative diseases that can be secondary to tick-borne infections. She wrote a memoir called What Lurks in the Woods, which is a book about her experience along with her husband in his unfortunate regression into a neurodegenerative disease secondary to tick-borne infections. Nicole earned her bachelor's and master's of science degree in material science and engineering from MIT, and she holds a master's of science in biomedical engineering from Duke University. So this conversation is focused on the complexity of tick-borne infections and their detection, and the wide variety of different health conditions that tick-borne infections can be linked to. Here is my interview with Nicole Bell. Nicole, welcome to the podcast.
Hey, thank you for having me. It's great to be here.
So we have a lot to talk about and a lot to go through. I'm going to talk about the book that you wrote, your experience. But before we get into the main conversation, give an overview of your education, your business experience, and specifically your current position at Galaxy Diagnostics. And then also just briefly describe, and we'll get more into this, kind of how you got involved in this work, advocacy for people with Lyme and other tick-borne illnesses.
Yeah, so I'm an engineer and scientist by training. So I actually have an undergraduate and master's degree in material science and engineering from MIT. And then I have a second master's in biomedical engineering from Duke. My professional career has been all in small companies, kind of entrepreneurial, bringing new technologies into the marketplace. I got that bug really early. My MIT professor founded a company straight out of, pretty much straight out of my college experience and got me on board. And I've really just been in startups ever since because I love the environment and it really suits my personality well. And so I've done various roles in engineering and marketing and business development, and that's kind of why I love startups. You do lots of different things, several successful ventures. The last half of my career has all been within medical diagnostics and medical devices. That was, kind of mid-career was when I went back to school to get my degree at Duke. And that was very intentionally to kind of get into medical applications because I saw it as a great opportunity for growth and a lot of innovation. And was doing well, had several successful companies that I really enjoyed working with, but then I got interested in tick-borne diseases for the reason that a lot of people do when it hits your family, and you have to deal with it. And so my husband got sick and we kind of got thrown into a cesspool trying to figure out what was going on. And I was a caregiver and we had young children and my husband really was quite sick. And that led me to kind of a passion for tick-borne disease advocacy. And eventually I really honed in on the diagnostics because so many things that are broken within tick-borne disease center around the inability to get an accurate diagnosis. And I'm sure we'll unpack a lot of that. But so kind of on the other side of my journey on the personal side with my husband, that seemed like the right area for me to slot in, right? We need better solutions. I've been in diagnostics. I'm an entrepreneur. And so I really just scanned the companies that were out there, and I came across Galaxy as having the best science and the best research in the space. And I introduced myself to the founders, and I ended up in June of last year taking over as CEO. And we're really looking to take the technology that they've developed over the course of the last couple of decades and bring it to a broader audience and a broader patient base.
So one of the things I've recognized being in clinical practice for many years is the difficulty in testing when it comes to Lyme and tick-borne. You know, it's not as difficult in other areas of medicine. Sometimes the diagnostic testing is very specific, but there's something about these infections that these organisms are incredibly sophisticated. They have an unbelievable way to survive and evade the immune system, which makes it, very complex. And you bring this up along with a lot of other things in a very interesting book you wrote called What Lurks in the Woods. And so I want to talk about that because this is a memoir of your journey with your husband, Russ, and his diagnosis and your family's journey and struggle through this process. One of the things that struck me about the book was very early in the book you mentioned, I believe it was your high school teacher, was it an English teacher?
Yes.
Who thought that you'd be a great fiction writer. And the one thing that struck me was you mentioned that you only wish that this story was fiction. So let's get into that. So tell us your story, and then we'll expand on the conversation from there. But let's start with your story in this book that you wrote.
Yeah. So, my husband, Russ, was a brilliant man. I mentioned that I like startups. So the first startup that I was in, we worked together, and, he was older than I was. He was about 20 years older than me, but we became really best of friends in the course of working together, and then eventually developed a romantic relationship, which I never really expected, but it was kind of just the way that it worked out. And we kind of moved across the country. We settled in North Carolina. We had kids. He wanted to step back and kind of be Mr. Mom and let me have my career. And that was going great. I kind of had a great career. I had a loving husband and 2 young kids, and I kind of thought I had it all. And then, as I said, he started to get sick. It started really more with mood disorders. So he was, depressed, anxious, irritable, things that made me think, hey, maybe you should not be retired. Maybe you should go back to work. This doesn't seem to be working for you, right? He became argumentative, and we were fighting all the time, and we had never been like that in our relationship. And so we went to therapy, but it didn't really help. And then I started noticing that he was forgetting things. He was forgetting the time to pick up the kids. He would forget the security code to our home alarm system. And this was a brilliant man, right? He was a computer science engineer, electrical engineer, absolutely brilliant. And he was forgetting basic things. And that was when it really cued me into that there was something a little bit more sinister going on. And I had to convince him that there was something going on and to go to a doctor. And one of the first things that I saw or that I thought of in my research and trying to help out was tick-borne illness, right? Like my husband was a hunter. He was always in the woods. He did all of our yard work. He lived all over the country in several areas that are considered endemic. And multiple tick exposures. And so we had him tested in our first doctor's visit. We went to an integrative, physician. So we didn't really kind of start with allopathic traditional medicine. We started kind of with somebody who would, in theory, dig deeper. But they tested him for Lyme disease. He tested negative. And really, and everything else that they tested for, they said his labs were quote unquote normal. And they referred us to a neurologist. And through a winding journey, he was actually diagnosed with early onset Alzheimer's disease, which, really felt like a baseball bat in the face because I was just trying to figure out what was going on. And actually the scans that he had done, he had a PET scan done, and the report came back that he was in late stage Alzheimer's. So
and how old was he at that time?
He was 59 at that time.
Wow. Okay.
So,
yeah, that's quite a shock.
Yeah, it was. And it didn't seem to make any sense. I'm an engineer, right? And I wanted to keep digging, and I'm like, okay, why was this happening, right? We had him tested for any genetic markers. He had none, any other infections. And actually I tested him for things like HIV and syphilis, and the doctors look at me like I was crazy, but it was the best that I could find in terms of infections at the time. And everything kept coming up negative.
And there was no family history.
There was no family history
either, right?
Just nothing. And he ate healthy. He had no comorbidities. Right. He was really kind of epitome of what you should do for brain health. But at the same time, he was, just declining rapidly. And so it was a complete shock and really didn't make any sense. And as somebody who likes root causes, it was, really didn't sit well with me at all.
So from there, I mean, you start that journey, you get that diagnosis, and obviously it's deeply concerning. And then eventually, I know that you found your way to a tick-borne Lyme specialist, and they were able to do some testing that confirmed the problem. What infections did he have? What was eventually found?
So he eventually tested positive, about 15 months after that first appointment. He eventually had him tested positive for Borrelia, which is the bacteria causing Lyme disease, Bartonella, which is a common co-infection, and then also Babesia, which is another common co-infection. So, people in the tick-borne disease community call them the 3Bs or the BBB, because those are the most common infections that you see, particularly in patients that are, really sick and struggling.
So where is Russ now? I mean, how does your book ends a few years back?
Yes.
And I mean, you went through a lot, and we'll talk about some more specifics, but where is Russ in this process?
Well, unfortunately, his journey didn't end well. So he actually, he passed away in January of 2022.
Oh my gosh.
So it was a difficult process. I mean, we treated for a couple of years, but it was late in his illness, and he responded well in some respects, but not in others. I made the difficult decision to put him into resident care in May of 2019, and then he continued to decline, and so he ended up passing away in January.
Well, I'm so sorry. Sorry to hear that. I know it's been very much of a struggle, and your book, does an excellent job. It's not a book you ever wanted to write, but it does an excellent job in describing that journey. I think it's important for a book for people to read, to understand the implications of this, the seriousness of it, and to expand look outside the box. Yeah. When you're dealing with, or a family member is dealing with some of these issues, because they can easily get just passed off as, well, that's just Alzheimer's, or that's just mental illness. So there's a couple of things that, happened in your story that I wanted to ask you. You wrote a chapter called Shit Happens. Yep. And I want people to hear this story. What was that? What was the shit happens?
Yeah, so this was, after we received the diagnosis of early onset Alzheimer's, and I was really struggling. As I said, I'm an engineer. I like root causes, and none of it made any sense to me. And so we went from neurologist to neurologist, looking for just somebody that would help us find some answers. And I had worked I was working in the medical community, so I knew lots of different people, and asked around and kind of got referred to this guy that was supposed to be one of the leading people in dementia in the Triangle, in North Research Triangle Park, North Carolina. We have great university systems. And so we waited for this appointment. I came prepared. I had my notes. I had my questions. I had sent all the scans in advance. I was like, this is the day I'm going to get answers, right? Because again, none of this makes sense. And so we went into the office and we kind of did the standard dementia playbook. It's like basic questions, draw a clock, repeat these words. And Russ was getting frustrated. And then, he started to dig into the history, and he didn't have the scans or any of my questions that I had set in advance. And so I was starting to I don't
think he had looked at anything prior to the consult.
Hadn't looked at any of it. Said he didn't even have it, which was clearly incorrect, because I spent multiple, times making sure that he had it. And I was hoping that he was going into this meeting with something, already prepared. But fumbling around, I had to use the disc of all of his scans that I brought with me and gave him that. And then he kind of just looked at it and said, well, based upon your history, I thought that maybe, he had frontal temporal dementia. But, looking at these scans, I agree with the diagnosis of Alzheimer's. And, Russ got frustrated and just kind of stormed out. And I sat there and I was like, hey, doctor, I know what the diagnosis is. What I don't understand is the why. Like, why is this happening? Like, he's, all the research that I've done says that this is his, he's young, and it's very rare to have people at his age, develop dementia without a genetic history. And also, he's just declining so rapidly. Like, none of this seems to make sense with what I'm seeing in the literature about Alzheimer's disease. And he looks at me and he's just like, Mrs. Bell, I know you're not going to want to hear this, but sometimes shit happens.
Well, I was telling you before we hit record, I was telling my daughter, I was reading your book, and when I read that, I about came out of my seat.
Yeah, well, I wanted to about strangle him.
I bet. So I have just a quick story, and it's not anything, as it was significant in that situation, but in your situation. So many years ago, I was consulting with a family with an autistic child, and they had moved away, and they decided to go see another doctor. So they saw that doctor, and they were having a consult. And I said, well, how'd it go? And she goes, he shushed me. I said, what? He goes, he had his back to me working on his computer, and I asked a question, and he went, shh. And I said, he shushed you? I said, I couldn't believe it.
Yeah.
And she didn't know what to say. So it was, I don't know, is it the callousness? Is it just, I don't know, if it's an uncomfortableness that some practitioners have, whatever, but that was unbelievable. So yeah. Another thing that you had gone through, and this is going to be common in just tick-borne Lyme treatment, but antibiotics and botanicals. Mm-hmm. Explain what happened with Russ, a little bit about sort of his journey when that one doctor was implementing a lot of different antibiotics. Sometimes he would get better, sometimes he'd get worse. And then you switch over to botanicals, which sometimes people think, well, the botanicals are just natural, it should be more gentle, but sometimes they can have just as profound of effect. So What was your experience with that?
Yeah, so we did go through a few different doctors as part of his journey. And the first one really was kind of a mixture of different modalities. But there was a very strong focus on broad spectrum antibiotics. And so at any one period of time, he could be on 6 to 8, or even more antibiotics. And it was in different protocols, take this one on Mondays, Wednesdays, Friday, take this on Thursday, take this. It was a very involved protocol meant to be targeted to the pathogens that he had on board. And that journey was really difficult. Like when we first started, there's a thing called herxing, right? Where, you get die-off of some of these organisms, and it leads to people getting sicker and confused. And people had described to me beforehand, who had been in similar situations, how, over the course of the treatment, which was a pulsing treatment, it was kind of on antibiotics, off antibiotics. And basically at the beginning of the pulse, there was an escalation of symptoms. Like I was frantic, just trying to manage his confusion, his disorientation, his symptoms. And then things would kind of level out and he would be okay. Then he would go off antibiotics because the theory is that these pathogens hide in tissues. And if you just do continuous antibiotics, then, you have things that are still persisting and you have to go off antibiotics for them to kind of free up and go. And then you hit him with antibiotics again. And so when he went off antibiotics, he would gradually start getting worse again. And then we would go back on. And it was like this roller coaster cycle. And, it seemed like the best option that I had at the time. And honestly, if you'd asked me about herbal therapies at the time, I would have said, I don't really know much about them. I don't see how they could be as potent as what you would get from a pharmacological solution. But I really changed my tone on that. When Russ went on a tincture that was really targeted to go after Bartonella. And, because the doctor was not only doing antibiotics, but also doing a lot of herbal therapies and immunosuppressants at the same time. And I gave him one drop of this particular tincture that was targeted towards Bartonella. And oh my goodness, the symptoms flares that happened and was crazy. And I'm like, oh, it can't just be, he just literally took a bucket of pills. And,
right.
How can one little drop of this one tincture have any implication? And so I'm a scientist and an engineer. So I just started playing with it. And I'm like, okay, we'll take him off. Then we'll put him back on. Same thing happened. And I'm like, wow, there's something going on there. And that was the beginning of me really understanding Bartonella, because at that time I was so focused on Lyme disease. And I think you don't really, as a caregiver or a patient, often understand the role of some of these co-infections. But two, really understanding the power of these botanicals and the fact that they could be an interesting, an important part of this treatment journey. And, so he was doing all sorts of different things. I think, after about 6 months on that really heavy antibiotics, he started to stall out and really not make any progress. At the time, the doctor we were seeing was convinced that was because of, Babesia infection. And I wasn't really convinced that he had Babesia at the time. We had taken some herbals. At that point, I believed in herbals that were targeted towards Babesia. He hadn't responded well. And everything that I read about Babesia said that, you should be able to pick it up directly with a PCR technique. And he only had antibodies and no PCR positives. And so antibodies, as I'll probably talk about later, just indicate that you've been exposed. It doesn't necessarily indicate active infection. And so I was just kind of not convinced. And most importantly, I talked to others who'd gone through Babesia treatment and they had really difficult times with the standard treatment he was recommending. And so we hesitated and I wasn't sure. And I think that goes to the status of a lot of these tick-borne patients is you don't know what infections you're battling because the tests are not that accurate. Right. And that was the biggest problem. And now I know. So as I said, my husband passed away and I donated his brain to science.
Oh,
and
wow.
Yeah, again, in search of answers, even after death. And so I now have PCR evidence of what is considered to be only really a deer species. It's only been published in human cases in a handful of cases, but a strain of Babesia called Babesia oticolii. So I now have PCR evidence that there's Babesia oticolii in his brain. And I think what we're learning about these pathogens is oticolii is a little bit different from some of the more common strains of Babesia, like Babesia microti, and it tends to sequester in tissues and be in fibrin nests. And I think we're learning and seeing that those pathogens behave differently. And I didn't know that at the time, and I didn't have the diagnostic tools that we're now trying to get out into the world to say, hey, you have this infection on board. And so anyways, to make a long story short, we tried all sorts of other different journeys, but I think we were just behind the 8 ball from the beginning because as I now know, these infections were deep-seated in his brain tissue. And when that happens, it's really difficult to get ahead. And it's even harder when you're not 100% sure which infections are on board.
Well, I think like a lot of things in medicine is we're probably always playing catch up, and particularly in the world of infectious diseases, because these things are not static. They're living entities. They change, they adapt, they develop variants. I've said it a lot of times with regards to fungus and bacterial problems, is these things have their own inherent ability and desire to thrive and survive.
Yes.
So, and they've been around a lot longer than we have. Real quickly with the Babesia, where in Russ's brain did it tend to settle?
There were multiple sections. I think we're still doing the testing even at this date, we're still kind of looking at the various sections, but we found, I have histological images of Borrelia in his brain. So I now know, even after all the antibiotics that he was on, there's still evidence of Borrelia in his brain. And we have PCR evidence of Babesia, and we're still, running testing to see what else we can find. So I'm not a neurological expert, so I can't rattle off the pieces of the brain like maybe others can, but it should be where they're proceeding towards publication, because I think some of the findings were really interesting. And I think, opening the door for a lot of these infections and how they can lead to, the onset of dementia.
It makes me wonder with his Alzheimer's diagnosis, if it settled into his hippocampus, because that is a major area of memory. Mm-hmm. By the way, did Russ have any, motor tics vocal tics, any sort of involuntary body movements that seemed odd and strange that he couldn't control?
Not that I remember. I think most of his issues were mood-based and then cognitive, in terms of, memory and, even some things were relatively undeterred. Like he could still drive and find his way, well into the advanced stages of the disease, but he couldn't do basic math or, count change. I remember him sitting on the floor counting change with my son, and he was doing it wrong, it was really interesting how some parts of his brain were so dramatically impacted and others were relatively unfazed.
So one of the things is for people to remember or appreciate when they're listening to this is that botanical treatments don't necessarily mean they're weaker or that, that they're not as effective. They can be extremely effective and they can be extremely powerful. The one drop kind of scenario, and I've seen this a lot in my patient population, particularly with some of the autistic children who are extremely sensitive to things. And so these botanicals can have a very, very powerful influence. One of the other things that you really saw for a while, a positive change in Russ, was stem cells. So what was that about?
Yeah, this was kind of getting to the point where I would try anything. And, one of the reasons we eventually got diagnosed, because eventually we went from doctor to doctor with no answers, but the way that we got diagnosed was because another member of my family, specifically my sister-in-law, through a completely different health journey, figured out that she also had tick-borne disease. And so my brother was going through a very similar journey. He's a doctor, and so he started researching. And one of the things that he came across was, stem cell treatment. And he was actually using Wharton's jelly, kind of from the umbilical cord, which is, so it's from a different donor, but it's in a format that, a patient or a host, when you put it into their body, doesn't get rejected like it might if you do some sort of other kind of transplant from another host. And he tried it on my sister-in-law, and she had really good results. And so I was like, well, hey, we'll give it a shot. And I definitely noticed with the first treatment, that he had energy, he was thinking more clearly, and we were seeing positive benefits. And we did multiple treatments, and I think the first treatment was the one I saw the most benefit from. I think later treatments, a little bit less so, but, again, he was on a lot of different things, but it was something I was very hopeful about. But as I said, I think we were behind the 8 ball from the beginning.
One of the things I've seen with stem cells is a lot of people will want to jump into that as I don't want to say a cure-all. Maybe some people are hoping for that. Can be effective for various things, but I've often found that therapies like that tend to be more effective when you've done other things. You've worked on other lifestyle factors, you've worked on diet, you've worked on gut problems. I know one of the other areas that was at least tested for and problematic for Russ was heavy metals.
Yes.
So the lead made sense, particularly with his being, a gun advocate. I think he kind of loaded his own bullets too. Mm-hmm. I think he also had mercury, I believe.
Correct. Yes.
What was incredible was his response to chelation therapy really seemed to trigger, from what I remember, the period of paranoia and hallucinations.
Yes. Yes, I used to call them thrilling Thursdays because it was right after his chelation treatments. And he would get extremely agitated. He would see things. They were my least favorite time of the week. And, and I still don't really know how much he had so much going on, right? With the heavy metals, which are toxic. He had 3 infections, which can all impact your brain. And so we were fighting quite a bit. And, but the heavy metals piece, still to this day, I don't really fully understand, should we have continued chelation? Should we have not? I was getting different advice from different doctors, and it was really challenging as a caregiver to really discern what the right path should be.
Well, you had mentioned that. So that one doctor was doing IVs and felt it was really important. I think you were halfway through the regimen. He was recommending like 17 more sessions. Then you went to the other practitioners like, no, just leave it be, because it's the analogy they gave was you're pulling it out on the dance floor and then it starts to cause more mischief.
Yep.
I'll be honest with you, when it comes to metals, it is confusing sometimes because people are concerned about redistribution. And I don't know if we know 100% that there's not going to be some redistribution. You can sort of bind to it. That's what the chelators do. But how do we know 100% that some of it's not going to come off somewhere else?
Yep. And then how is it interacting with all the other things that are going on, right?
Exactly.
There's a lot of variables.
Have you, what about Russ's brain now? Have you stained or analyzed it for metals?
We have not. I think we've been really focused more on the tick-borne piece, but I think that's a follow-up in terms of really understanding, where that was in terms of, in relation to some of these infections as well.
He was under a lot of antibiotics. So one of the big problems with antibiotics is microbiome disruption and then opportunistic fungal infections. Mm-hmm. Was there an aspect of his treatment where his fungal levels got very high? Maybe he was treated with antifungals, nystatin, diflucan, whatever, maybe botanicals. I don't know if that was really a part of his picture.
Yeah, it absolutely was. So the first doctor's visit, they identified that he had, a pretty significant candida infection, and he wouldn't even start us on antibiotics until we addressed that. And so before he even started the tick-borne treatment, he was on a course of, I forget exactly, it's probably diflucan, but I can't remember the specifics at the time. And then as part of the antibiotic regimen, as I mentioned, there were different pills on different days. One of those was nystatin that he would be on at some sort of frequency to make sure that he wasn't getting fungal propagation in his gut.
Right. Okay.
Along with a lot of other probiotics and other things to kind of help with that microbiome issue.
Yeah. And that's unfortunately the inherent downside or troublesome aspect of Lyme tick-borne illness treatment is the prolonged use of these antibiotics. I've seen the same kind of thing in my patient population with some of the autistic children. They've got Clostridia, bacterial problems. Most of the time we can deal with it through probiotics and other supplements. Sometimes they need antibiotics, and there's always that downside, of the microbiome issues. So with regards to tick-borne illness, many people just look at it as Lyme, and it's clearly more than just Borrelia. So can you walk us through just some signs and symptoms of Babesia versus Bartonella versus Borrelia, and what I know there's overlap, but there's also aspects where some of these things are unique to each infection.
Yeah.
So what's been your experience and knowledge with regards to that?
Yeah, I think the first thing to say is exactly what you just said, is that there is an enormous amount of overlap. And sometimes it's very difficult in a patient to understand just from a clinical diagnosis what's what, because you get a lot of overlapping symptoms of, fatigue, anxiety, you can have brain fog, you can have joint issues. I think that when you start thinking about what are some of the key differences that we see, among the different providers and so forth, a lot of the, rage, irritability, of even violent behavior, many of those cases often are associated with Bartonella. And one of the things that has been shown in the research, and we have a few case studies that are really quite moving, where patients that have been diagnosed with schizophrenia or, having psychotic events, they actually have high rates of Bartonella on board. So like, for example, our founder, Galaxy's founder over at NC State, did a joint study with UNC, and they scanned 17 patients that are schizophrenic and found that 65% of them had Bartonella on board, compared to 8% of controls. They did a follow-on study with Columbia of over 100 patients and found that about 46% of patients with a psychotic event, also had Bartonella on board, which is 3 times higher than the control group, right? So absolutely, paranoia, the hallucinations that you read about in my book, I attribute that to the Bartonella. And I think that's consistent with some of the diagnosis that we've seen and some of the exploration that we're doing into schizophrenia.
And where do you get Bartonella?
Bartonella can come from a lot of different biting insects. So generally, it's considered fleas. So if you Google Bartonella, it comes up as cat scratch fever, and that's kind of the acute form of Bartonellosis. But I think what we've learned over the couple of decades of research from our founders is that it has a lot of manifestations in the chronic form as well. And the other thing people don't realize is that the majority of household cats actually have Bartonella on board, and the Bartonella is like 6 orders of magnitude higher in their bloodstream and the quantities than it would be in a human, right? So they're natural reservoirs for the bacteria. So if you adopt an animal, if you have a flea infestation, if you have an open wound and a cat licks that wound or scratches you, that's again the cat scratch fever. Yeah. That's a great transmission mechanism. Also body lice, that's another mechanism for certain types of Bartonella. There's also spiders have been documented, sandflies. There's any biting insect essentially. But I think Bartonella is actually way more prevalent than people realize. I think if you talk to Dr. Breichwart, our founder, he'll say it's more prevalent than Lyme. And you can have it on board and not necessarily be sick. But if you it's like one of those things, once your immune system, if you reach a tipping point, maybe you get another tick-borne infection, maybe you get COVID, maybe you get into a traumatic accident, then all of a sudden the disease manifestations can really flare. And it's been indicated in mental illness. It's been implicated in pans pandas, lots of kids with this acute neurological symptoms and seizures. A lot of people with seizures, you can see that within Bartonella, and ocular eye issues is also a common complication. So there's lots of different challenges and, with that particular pathogen.
If somebody was going to develop an acute reaction to Bartonella, do you know what's the typical time frame that might occur?
I believe it's within the immediate exposure. So if you get scratched by a cat, like within a week or so, you're going to get kind of the lymph node, you're going to get fever, you're going to get kind of this classic cat scratch fever symptoms. And you can get treated. If you get treated appropriately, it may resolve. The CDC guidelines say that it may self-resolve on its own. I think that what we see is that it's one of those pathogens that can kind of stay on board and then get reactivated. Okay. And so you really need to be aware if you're seeing some of these symptoms. We really encourage people to get screened for Bartonellosis because, we have case stories. There's one that I talk about quite a lot where as a 14-year-old boy, actually the exposure event was when they adopted a cat. And he got scratched and the parents didn't realize it at the time, but he developed sudden onset psychosis. He was diagnosed as schizophrenic, thought he was going to kill one of his siblings. He was threatening his younger sibling. He was suicidal. His parents were completely at a loss. They had to institutionalize him. They spent over $400,000 on psychiatric care. And then a very astute practitioner noticed these striations. They kind of look like stretch marks. Right. And
I've seen those images.
Yes. And so she realized that that's associated with Bartonella. She connected this boy with our founder over at NC State. They tested him for Bartonella. He tested positive. He got treated with, standard antibiotics, rifabutin, rifampin, and he got his life back. Within weeks of being on these antibiotics, his symptoms evaporated. He was able to go back to high school. He graduated valedictorian of his class. He went on to college, right? I mean, this is a boy who was institutionalized and medicated until he was drooling, and he got his life back, right? So this is why we do what we do, right? Is to give people the testing results they need to get well.
Yeah. I mean, you look around and you just wonder how many people, who are on the streets, who are in hospitals, who are, just being overlooked, have these kinds of infections. What about Babesia?
Yes. So Babesia, I think if you look again, and I think our knowledge of Babesia is really evolving. Actually, another one of our founders over at NC State last year at the one of the top Lyme conferences, he did a presentation called Babesiosis, the tip of the iceberg. And I think that's really where we are in terms of our understanding of Babesia. So if you, again, look on the CDC website, they'll talk about the most common strain in the United States being Babesia microti. And that is a more bloodborne infection. So it infects your red blood cells, and the parasitemia is generally about 1%. So since it's in your blood, you get access to your immune system. And so in some of those conditions, you might get night sweats. Air hunger is another one that's commonly associated with Babesia. Extreme fatigue. And, those are kind of the more quote unquote classic symptoms. But if you learn nothing else from this podcast and you don't realize that classic symptoms and tick-borne disease is kind of an oxymoron, right. because they're very different. But one of the things we're realizing is there's other strains of Babesia that have not been really thought to be prevalent in humans. In the research that is being done over at NC State, they're finding higher rates in chronic patients of Babesia oticolii, which was only thought to be in deer population. But it's very prevalent within ticks in kind of the Pennsylvania and Northeast area, which ironically, my husband used to do a lot of hunting and shooting out there. And then Babesia divergens, which was thought to really be a European strain, but we're finding in a lot of these chronic patients. And the reason that that's important is because, again, these are oticolii in the research, which is, again, still emerging. It really likes to sequester in the tissues, and it kind of hides in these fibrin nests. And so that's important for a couple of reasons. One, it's in lower levels, so you might not pick it up with traditional testing if you're doing a PCR test, for example. And two is the symptoms, as we're digging into some of the cases that we're identifying with these particular patients, they tend to be a little bit more of the non-specific symptoms: fatigue, tingling, small fiber neuropathy, like really just kind of more general conditions that often get put in multiple different diagnosis buckets. And so Babesia is a challenging one. I think there can be very telltale symptoms that say that you might have Babesia on board, but I think what we're learning is that it's a little bit more complicated than that. And then also the other thing is some of the sickest patients that we've seen, or some of our Bartonella patients, for example, that haven't gotten better with classic Bartonella treatment, they actually also have Babesia on board. And that's part of one of the, competing and complicating factors.
So what you're describing is the organism can live in various tissues throughout the body, but also in the red blood cells.
Yes.
So one form, do you know if it can lead to hemolytic anemia? I mean, just cycles of that could probably be part of the fatigue, component.
In the more acute forms, absolutely. But like I said, what we're finding is really low level parasitemia. We've recently just released kind of new test capabilities which have better sensitivities than what you typically see with traditional PCR. And what we're finding is really low level infections. And these are patients that have not previously been diagnosed or suspected of having Babesia on board. And we're finding that that's actually potentially what's holding them back in their treatment.
Well, we know that Babesia and Bartonella can be widespread. Now, the good news is Lyme is only in Lyme, Connecticut, so it's not spread beyond there.
Yes.
What? Yes. So great description of Bartonella, great description of Babesia. What about Borrelia?
So Borrelia is, that is another interesting one because, again, it can go after all sorts of different tissues. So it's been well described in rheumatologic patients, as is Bartonella, which I kind of skipped over in the Bartonella section. But there's been also, if you look at, Bartonellosis, there's a lot of arthritis, type indications as well. But so Borrelia can go after the joints. It's also known to kind of infect the tissue around the heart. So Lyme carditis is also something that if you have strange heart palpitations, it can lead to, in some cases, needing to get a pacemaker installed or a heart transplant. There was a local physician here who's actually a Duke oncologist, Dr. Neil Spector, and he had, third degree heart block and needed to get a pacemaker installed and eventually a heart transplant. And he repeatedly tested negative for Lyme disease, and they didn't figure out that actually that was what was causing his condition until he was at the point where he needed a heart transplant. And so, a lot of people, there's my favorite word in medicine is idiopathic, right? Because it's like basically we have no idea what's causing your symptoms. And there's a lot of idiopathic heart block out there. And people could get tested for Lyme and test negative, but that actually might not mean that you're not infected, if I'm using too many negatives there, but you might still be infected. So it can impact the heart, and then it can also impact the brain. So there's been several case reports, very similar to my husband's, where people would, get dementia symptoms, several case reports where upon appropriate treatment, their dementia symptoms go away and they kind of return to normal cognitive capabilities. So it really depends on, which tissues that it infects. And that's why it's called the master mimicker, because it can be variable. People's immune systems respond very differently. So some people can have a very good immune response and clear the infection very easily. Others might have actually no antibody response, and therefore that's one of the reasons they're not, testing positive, is because a lot of our testing is based upon antibody presentation. And so again, it's very, like I said, if the one thing you take away is there's no such thing as a typical tick-borne case, it can be very, very variable.
Which brings to the point of the discussion of the struggles of testing. So we've got the conventional medical system, which has their criteria, Western blot testing. The CDC has their own I guess, outline or criteria, so to speak. And then you're looking at testing kind of within the integrated functional medicine world, if we want to call it that. So why do you feel the conventional medical system is still relatively clueless, when it comes to the reality of tick-borne illnesses? And being here on the West Coast, there is an assumption of, Lyme disease, that's just back, that only occurs back in the Northeast. Maybe it's more recognized back where you are. But I think in general, it's often overlooked. Doctors don't appreciate it, don't recognize it, don't know where to look. Maybe it's a combination of that. But what's been your experience there?
Yeah, I think we hear a lot of times, people say, well, the doctor says Lyme doesn't exist in my state. And I think if you, it does, right? We have all sorts of data that shows it's all over the country. And then also, even if it wasn't, do people not travel, right? Do people not go places these days, right? So it really is everywhere. We have, reports all 50 states. And so I think it's just something that people need to be aware of. And, the standard of care test, one of the things that I didn't fully appreciate when I entered into the caregiver world was that the standard of care test, so if you just go to your primary care physician and you say, I want to get tested for Lyme disease, the test that they're going to give you is about as accurate as a coin flip.
Wow.
Right? 50% accurate. The data says 40 to 60% depending on which lab that you go to and which test you're using. And I think as a rational person, and, again, I'm an engineer, right? It just seems crazy, because what other disease state would that be acceptable, where, it's basically a 50-50 chance whether you're going to get an accurate result. And, but it's been documented time and time again in the literature and the scientific papers and so forth. And I think the challenge, as you mentioned earlier, is that these pathogens are different, right? They're extremely stealthy. They evade and suppress the immune system quite actively, right? Like they manipulate cytokine expression. They literally swim faster than the fastest immune cells, so they can quite literally evade. They hide in immune privileged sites like the brain and the eyes and the joints, where the immune system doesn't have full access. And the test, so getting a direct test, like a PCR test, has been really challenging. So what they've been doing for decades is using antibody tests, right? So, and the challenge with this is that that's not a direct test. That's considered an indirect test. And the reason is that because it relies upon you, the host, and your immune system having a reaction to the pathogen. And that's flawed for a lot of different reasons. One, even with a perfectly functioning immune system, right, you want to catch and treat that tick-borne illness as quickly as you can. Studies have shown the longer you wait, even a 30-day delay in diagnosis makes you 2 times more likely to have ongoing chronic symptoms and ineffective treatment. So you want to get tested as early as possible. But antibodies, particularly the most specific antibodies, which are IgG, those take 4 to 6 weeks to peak. So that 30 days that I just talked about where you're,
right.
You just missed it. So that's problem number 1. Problem number 2 is we're all different, right? My immune response would be completely different from your immune response. And, it's been shown in animal models and in humans that people have very different antibody reactions, and that can lead to different testing results, even when the pathogen's on board. And then the third major thing is that people who are chronically ill, people like my husband Russ, people like Dr. Neil Spector with a cardiac case, when you're really sick for a lot of years before you figure out and decide to, and finally get the knowledge to get tested with Lyme disease, your immune system has been fighting a pathogen for a really long time. And so it's suppressed, and you might not be producing enough antibodies in general to trigger a positive test result. And so there's more reasons, but that's one of the challenges with the testing that's out there is it's an indirect methodology that's going to miss a lot of patients.
Well, the other thing too, if you're talking about Babesia, that is sequestered into the red blood cells and some of these other pathogens that get into the cells, the antibodies aren't going to do anything. Right. So they're not, and it's been hiding out. And even if you're trying to mount an antibody response, over time, I don't want to say the immune system gives up, but the immune system may move on, or even if they did have the antibodies, it's not going to be effective against it. Maybe it's natural killer cell based. It's obviously very complex. We know you mentioned in the book too, this is seen with other organisms, fungal organisms, certain bacterial organisms, form biofilm. Do you feel that the biofilm component is a major contributing factor to why some of these tests don't pick things up? These things get embedded in these biofilm colonies?
Yeah, absolutely. Biofilms sequestered in tissues. Look, a test is only as good as the sample that you take, right? And so, our Dr. Breischwart always says, if I'm in a boat and I take a bucket and I put the bucket in the ocean and I look in the bucket, if I don't see a jellyfish, does that mean that there's no jellyfish in the ocean? Right? No.
Right.
It just means you didn't get any in your bucket. And so that's the problem that we have with these, stealth or low abundance pathogens is that you need more sensitive testing techniques, right? So, and that's been the challenge, right? And if you just think about in other disease states, right? Like for COVID, if you want to know if you have COVID, you don't be like, oh, hey, Dr. Woeller, I want to get an antibody test for COVID to see if I have COVID. Like, nobody does that, right? You'd be like, I want an antigen test or a PCR test to tell me if I have COVID right now. But those tests just haven't existed historically. And so antibody testing is what we're limited to, at least in the allopathic space. I don't want to, say, hey, this is all doom and gloom, because there are better solutions out there. That's why we do what we do. But if you go to your traditional allopathic doctor, then you're going to get a test that is about as accurate as a coin flip. So a positive tells you you're on the right track. Generally, there's caveats to that, but a negative is really just you might want to keep digging.
So what I've seen too in medicine is even if the test came back positive conventionally, sometimes it's ignored.
Yeah.
I've seen that with H. pylori. The person has classic symptoms of it. They do a test, shows IgG, and then the excuse is, well, everybody has IgG to H. pylori. It just means a past infection, but they're symptomatic.
Yeah.
So what's unique about Galaxy Diagnostics? And discuss some of the testing technology that you have.
Yeah. So, I kind of went through a lot of the challenges with antibody-based testing, and I think on the other end of my journey with Russ, I realized that was where our journey went wrong, right? And so I started looking around for different testing options. Okay, there's got to be a better solution out there, right? And there are, and I think there's better antibody tests from some of the specialty labs and so forth. But at the end of the day, what I think the right answer is solving that direct detection problem, getting to an accurate antigen test or PCR test that can tell you whether or not the pathogen is on board. Because as you said, antibody testing just says you've been exposed, and it's challenging from a lot of perspectives. People might not believe you. You might know that you've had the pathogen and you've been treated, but you still feel sick. So is it because you still have the pathogen on board and it hasn't been eradicated by your treatment? Or is it just an ongoing, immune activation that maybe is related to other things? And so it's complicated. So direct detection, if you can solve it, is the right thing. And so I started looking around at all the research and all the different things that were going on. And I came across the work at NC State with Dr. Breischwart and the company that he founded at Galaxy. And that was really the key problem that they were trying to solve, is how do we increase the sensitivity of direct detection to give an accurate result to clinicians. And it's also a real understanding of not only how to do that, how to enrich, how to do different sample enrichment techniques, because that's a lot of the core of the technology that we do, but also understanding the microbiology of the pathogen. So no matter how sensitive a test is for Lyme disease, blood's not the best sample. Right. So one of the things, it's generally in like 1 copy per milliliter. Right. If you just do the math.
And that's for Borrelia.
That's for Borrelia.
Okay.
Right. And so if you do the math, and you're looking at trying to catch Borrelia with conventional PCR, you're about as likely to get struck by lightning in your lifetime as you are to catch Borrelia with a PCR test, right? And so one of the things that is actually we do at Galaxy is we don't look at blood as a sample. We actually look at urine. And why do we do that? Well, I mentioned that the pathogen Borrelia has a lot of evasion techniques. One of the things that it does is it actually spits off these surface proteins, to confuse the immune system. It changes its surface proteins, but it also spits them off to capture. If you do have antibodies in your blood, they'll bind to the free surface proteins and not the pathogen itself.
Wow.
And so then those surface proteins, they actually get filtered through the kidneys and then they get excreted in the bladder. And what researchers at George Mason University figured out is that you could actually capture and concentrate these proteins and detect them in urine. And it led to highly accurate diagnosis in both the acute patient population, and also is really useful for discerning in chronic patients. Again, lots of people get treated for Lyme and then they still feel sick. And so the question is, why are they still sick? Are they still sick because Borrelia is persisting, which has been shown time and time again in the research? Is it because they have another undiagnosed co-infection? Is it because they have immune dysregulation? Like, this is the question doctors have. Antibody testing isn't going to help you figure that out.
So that's very interesting. So one of the, I know challenges, I don't know if it's a challenge, critiques, I guess, of PCR is that if you set the spin cycle too high, you're basically going to be picking up on fragments of DNA, but you can have it so sensitive that it becomes meaningless. And you're going to know a lot more about this than I am. And this was something that we experienced in COVID, right? They were setting the spin cycles very high and then everybody tests positive.
Yeah.
But, it becomes meaningless if everybody's being detected. And I think one of the inherent challenges of PCR is, are you picking up on fragments of something that is no longer alive, but the remnants are there, or is it an active infection?
Yep.
But this other test you're talking about, these proteins that are being thrown off, that I'm assuming is only going to occur from an organism that's actually living.
It's a good indication. You could still be clearing the infection. I think we still need to really do the studies to say that definitively, but it's certainly a good indicator that, the infection's on board, and it's something that you need to consider. And we have seen, in monitoring people who have been treated and successfully resolving, we do see those the antigen quantities go down. And so that's the technology that we use for Lyme disease. And I agree. So, and then on the PCR front, because we do use PCR for some of the co-infections, that's a blood-based test that we do use. And I think it's just like any other test, right? So it's all about your design, right? You can have primer and probe designs that are very specific and very accurate, and you test those to a rigorous standard, or you can have some that maybe have non-specific binding and give you some false positives. And so just like everything else in science, or anything else in life, frankly, you can do something well, you can do something poorly. There was a little bit of that went on in COVID. And again, that's another thing that drew me to Galaxy, is really the commitment to science, the commitment to quality and excellence, and really trying to make sure that we, when we give a positive result, that, you can proceed with confidence because we know that it's on board.
How much of tick-borne illness treatment do you, even today, and I'm sure it was probably happening with Russ when you first started, and his story isn't that long ago, right? We're not talking like 20, 25, 30 years ago.
Nope.
But people are treated really more on their clinical presentation as opposed to entirely being 100% dependent on labs. I mean, I'm a huge proponent of lab testing, but I understand some labs are better than others. Some are more descriptive than others. And a lot of times it comes down to your presentation sounds like it fits. Let's move forward with some type of treatment to see. And I know this has to exist in the tick-borne illness world, where people are being treated based on their clinical presentation and not entirely what the lab test is saying.
Yes. I mean, tick-borne disease is still considered a clinical diagnosis. And as I said, that's challenging because a lot of these symptoms overlap. And like I said, as we're learning about babesia, maybe some of the symptoms are not as specific as what you might think. And so this is really the mission at Galaxy, is to give better testing options so clinicians don't have to guess, right? So that you have definitive evidence of these are the pathogens on board. Because if you think about Borrelia, Bartonella, babesia, they have very different treatment protocols. If you're going to go after kind of, they have different antibiotics for Borrelia and babesia, or Borrelia and Bartonella, sorry. And then babesia is a parasitic infection. So that actually, the treatment is more like a malaria treatment protocol. And so understanding which one's on board is really important. And I think a lot of the reason why some patients are sick for years, because they don't necessarily, you might get a diagnosis, but there might be other things that might have been missed or that confuse the situation. And that's not even mentioning the overlap with mold, and other type of environmental toxins. And as you mentioned, my husband had heavy metal toxicity. And so there's a lot of complicating factors where you really need to have accurate test results in order to figure out what the method of attack should be and maybe what the order of attack should be.
Yeah, that order of attack is really important. That comes up a lot because I deal with that every day. It's like, what do we go after first?
Yep.
And it's sometimes it's a straightforward, assessment. Sometimes it's not, because again, you have a lot of overlap and a lot of conflicting, types of things. So why do you feel, or maybe I shouldn't say why do you feel, or the research and probably the people you surround, are we seeing more tick-borne infections, or is it just being diagnosed more because the diagnostics are better? My impressions is that there's more of it. And what are the reasons for some of that, do you think? And what's your impression?
I think it's a multifactorial equation, right?
Okay.
So let me start with the diagnosis piece, because I do think that we are uncovering more tick-borne disease as the diagnostics improve. And so I talked about our Lyme-based testing with the urine side, but we also do DNA-based detection on the blood-based side. And we use proprietary culture media, and we use a technique called digital PCR, which is more sensitive than what you would get with conventional PCR. And I guess the best analogy that I could utilize is like it's like you're trying to find a needle in a haystack, right? So conventional PCR is like you're trying to find one needle in that big haystack, and you got one shot at it, right? Really difficult pursuit and endeavor. Digital PCR, it takes that haystack and it separates it out into 20,000 piles and then interrogates each one individually. And so you're going to have a much better chance of finding that needle. And that has, in the research setting, uncovered a lot of previously undiagnosed infection. And we just launched what we call the BBB assay, which is Borrelia, Bartonella, and Babesia. And we're finding, we've had the Bartonella assay for a while, and we get good results with that test. But as we've added on Babesia, we're finding a lot more of these low-level Babesia infections that have not been previously diagnosed. So I think to your question, first thing is yes, we are getting better diagnostics and people are getting diagnosed. Secondly, I think there is a prevalence issue. I think that, there's evidence, even from the CDC, tick populations are rising, disease populations within those ticks are rising. And so I think that's a key aspect of it. And then I think the third aspect of it is we're seeing more of it. I mean, tick-borne disease and Borrelia, some of these pathogens, they've been around forever. But why are they becoming endemic, and why are they becoming so debilitating for us? And I think it's because as a population, we're becoming sicker, right? We have all sorts of different exposures. Our diets are not as great. And we're, again, like I said, with Bartonella, you can have this pathogen on board and be very healthy. And then all of a sudden your immune system reaches a tipping point, and then you descend into illness. And so I think we're seeing a lot more of that because as a whole, as a population, our immune systems are not as healthy, and it makes it harder to keep some of these pathogens at bay. And so again, multifactorial.
Is there any research into the virulence of these pathogens? I mean, are they becoming more sophisticated where there's now different variants that are becoming much more problematic than, let's say, 20, 30 years ago?
I don't know of any of that. I think we're still understanding some of these mechanisms in the first place. And as we know, evolution doesn't generally work on rapid scales. I know it does in viruses, but not as much in, the bacteria and the parasite things. Could it be happening? Yes, but I don't think we know enough about each of the particular species in general before, and then, to take that secondary step of, okay, is it getting worse than it was 20 years ago? Because some of these pathogens we didn't even know existed 30 years ago. Right.
What about animal reservoirs? Are they seeing, different animals now carrying these things that perhaps didn't in the past?
Yeah, I mean, we believe very vehemently about One Health, right? So we live with our animals. We know that cats are a natural reservoir for Bartonella. Dogs and cats generally have a lot of these pathogens, like Lyme disease. Your dog can get it. Babesiosis has been documented in all sorts of different animal models. That's one of the benefits of actually working with the team over at NC State. They're actually not in human health medicine. They're actually in veterinary medicine. And if you talk to Dr. Breichwart, he'll tell you he kind of got dragged into human medicine because he started looking at these pathogens in dogs and cats who are his patients. And then he was finding all sorts of symptomatology. And then as he was talking to his colleague, he realized his colleagues started saying, hey, I'm having a lot of the same symptoms. Can you test me? Right? Because veterinary, workers are high risk patient, population. And so he started testing his colleagues and veterinarians, and sure enough, they had high levels of some of these infections. And so, and then now we all live and sometimes sleep with these animals, and we're bringing, there's a story that you read in the book about how my daughter had a tick, crawling across her stomach after she got out of bed in the morning. She hadn't even been outside. She came down for breakfast and she hugged my dog. And then next thing you know, she has a tick crawling across her stomach. And so absolutely, I think we need to think more and more about animals as an exposure risk. A lot of people that I've talked to are like, oh, well, it can't be a tick-borne disease. I've never been bit by a tick. And it's like, well, first of all, do you really know that? Because a lot of these ticks are really, really small. And most Lyme patients actually don't remember, people that with known Lyme disease don't remember being bit by a tick. And then second of all, it's like, okay, well, do you have animals? Do you have a cat? Do you have a dog? Like, these are also known exposure risks that a lot of people don't think about.
One of the things, too, I recognize in your book you mentioned is every time you would actually go out in the woods, you would spray yourself with, the insecticides. I forget what was the chemical. Was it? I use picaridin, and then we use permethrin for our clothing. Permethrin, yeah. So there's actually been studies with permethrin that people exposed to that, moms, for example, being exposed to that have an increased, I think it's twofold risk of autism, in their offspring.
I did not know that.
So there's some of these are neurodevelopmental toxins. And so, you're sort of living in this balance of, I don't want to get bit legitimately, but then you're dousing yourself with these toxic chemicals, so and I'd imagine some of the problems too is the encroaching on wilderness areas.
Yes.
We're moving into these, and this is a big problem out here in the West is the wildfires. So, everybody wants to live close to the woods. Mm-hmm. And so, you're just getting communities that are being built into some of these forests that are dry and brittle. And then people are surprised when their neighborhood burns down, mm-hmm. Huge problems. Obviously, there's a lot more to learn and a lot more to discover. So what are some action steps that people can take if they have a concern about tick-borne illnesses, infections for themselves, for example? Maybe they're dealing with a family member. What do you recommend?
If you suspect that you have one of these, infections on board, I would recommend getting accurate testing, right? That's number one. You can start with your traditional doctor and you can get the standard test. As I said, what you're going to get is generally going to be about as accurate as a coin flip for Lyme disease. So if you get a negative, do not be discouraged. Just keep digging deeper. And then most allopathic traditional doctors will not test you for Bartonella, Babesia, Anaplasma, Ehrlichia. We haven't even talked about some Rickettsia, some of the other infections that you can get from a tick because, ticks are nature's dirty needle, right? So you can get a lot of these pathogens, not just one. So, really, if you can, and a lot of people struggle because it's expensive, but if you can go to kind of a functional medicine provider or a tick-borne specialist, go and get accurate testing and get tested for a panel of pathogens and really look at what you might have on board. And so, this is what we do at Galaxy, where we have information on what the testing that we have on our website. But that's the number one. And the other thing that I would say is really just don't give up advocating for yourself. I think after that first negative test result, we went on a long winding road, that diverted us for about 15 months. And one of the questions that I always ponder is, if we had gotten an accurate diagnosis at that first appointment, where would we be right now? Right. And so you got to keep digging. I think, there's a lot of doctors that'll tell you shit happens and just find another doctor. Right. Like it's sad. I can't tell you how many people that have been, they don't have the shit happens quote like I did, but they, say they get referred to a psychiatrist. It's like, have you seen a psychiatrist? Maybe it's all in your head. And it's like, no, it's not in your head. Like, you're sick. People know that they're sick. And so, you just, have the fortitude to keep going. And that was one of the reasons that I wanted to share our story is because the journey that people go through is just it's hard and it's crazy. And so I want people to know that, there's other people out there. I think as I started sharing our story, I realized how common it was, unfortunately.
Did Russ have any genomic testing done?
Genomic testing?
Yeah.
Yep.
Yeah.
Full genome sequencing, actually.
Okay. Was there anything in his, variants that maybe increased his susceptibility to
not that they
infections
identified.
like this? Okay.
Not that they identified. So nothing that associated him with Alzheimer's disease. And I think nothing that was flagged in any of the common, testing.
Yeah. Nothing like from an immune system, like his immune system was more driven towards inflammation, or neurological inflammation, nothing like that. Nothing like that.
But I think, again, we're still really figuring out, why do some people have a strong immune response and why do others not? How do the T cell, manipulation and some of the cytokine expression actually impact the way that your immune system interacts with the disease? I don't think he had a genetic basis. I think in his case, with the multiple infections, with the heavy metal toxicity, with the candida, he had a lot of toxic elements at the same time that really led to that tipping point, getting reached.
Yeah. So any advocacy groups that you're part of or that you recommend for people who are, looking outside the box, who are being gaslit, unfortunately, it's all in your head, you're crazy, and they're not, that you recommend?
So first of all, I really am a big fan of the Center for Lyme Action. So I've worked with CLA for a couple of years now, and actually one resource that I would point people towards. Before I joined Galaxy, I partnered with CLA to write a summary of the state of Lyme disease research. So this is a document that CLA wanted to produce, really an overview of the science, because I think part of the confusing nature and something I experienced as a caregiver is, you read all the different things, and some people say chronic Lyme exists, chronic Lyme doesn't exist, and you read different research papers, and one paper would say, the bacteria is killed after 2 weeks of antibiotics, and others would say it persists for years. And it's like, what's the truth, right? What's the research? And so private foundations have actually funded a lot of research within the space, and some great work has been done over the last, 10 to 15 years. And so CLA wanted to summarize that research in Lyme disease and use that to go to Congress to lobby for more spending, for more research funding from National Institutes of Health and other organizations that can actually fund and sponsor research. And so I agreed to take on the project because it was frankly something I wished that I had as a caregiver. It's like, okay, how can I wade through all of these scientific papers? And I'm an engineer and a scientist, and so I'm used to reading scientific literature, but most people are not, right? It's not accessible to the average person if you're not embedded in science like some of us are. And so that paper, we really tried to make it accessible to congressional staffers so that they understood what was going on. And so what I try and do is encourage patients, hey, this is a great resource for you to understand the impact to, heart conditions, brain conditions, where we are in the research. And it's also something that you can share with your doctor, who might be a little bit of doubting, whether or not this is a real thing or whether it's endemic in your area or something of that sort. So I really like CLA. We've got that paper that's on their website. There was a couple of webinars that we've done, which are also posted on their website. Actually, we're in the process of updating that because that was published a couple of years ago. And so we update it annually with some of the latest research. And so that's a great resource. I think there's also lots of other great advocacy organizations. So Project Lyme, the Global Lyme Alliance, Lyme Warrior. Those are resources where they have websites, social media. They have lots of different information that people can look to and, get access into the community, because unfortunately a lot of people get diagnosed by their friends. Right. Once you see tick-borne disease, it's a lot easier for you to see it in others. At least get to the point where it's like, hey, you should get tested. I'm not a doctor. I'm not going to prescribe you antibiotics, but you should at least go get tested because you've got some symptoms that are kind of pointing that way.
A question I want to ask you before we close this out, and we assume that these are problems only here in the United States. So how much, from your experience and now in the research you're doing and the testing that people you're connected with, how much of an issue is Borrelia, Babesia, Bartonella, maybe it's all three, around the world? I mean, so This is clearly something that has, not obviously just on the East Coast of the United States. So, people who are listening to this internationally should be thinking about these things too.
Oh, yeah, absolutely. It's a global issue. And one thing to consider is that, even though I know that all three of those, genus of bacteria, right, the broad category of bacteria exists kind of globally, you do get different strains in different areas, like Europe, for example, has different strains of Borrelia that are more prevalent and prominent. Same for Babesia and for Bartonella. And so that's another thing that makes antibody testing interesting, because often the antibody tests are specific to the strain, not to the genus, right? Which is like, if you think about the genus, that's like the family, and then the strain would be like the individual family members. And so, or the species, sorry, not the strain. So genus and species. And so, It's important. It's one of the reasons at Galaxy we do testing at a genus level, not a species level. And so, but it is a global problem. Europe has been endemic for Lyme disease and some of these other pathogens. I think globally, some areas I'm sure have lots of areas, or lots of prevalence, but not necessarily test. I think in terms of the epidemiology, I'm sure Dr. Breischwer could speak to it more eloquently than I could. But he has collaborators in South America and other places that are looking at similar, pathogens, because it really is a worldwide problem.
Do your test kits ship internationally?
We do international shipments. The challenge is since our blood-based technology we do a culture, you have to do it overnight, and that gets expensive.
Right.
But we do it. And as long as somebody can, figure out how to get the samples here with rapid shipping, then we will do the testing.
Well, the urine sample is probably a little bit more stable, I would imagine.
It still needs to arrive cold. So you still need to ship pretty quickly. Okay. So we have had issues where it gets held up at customs and other types of things. So it's a little bit of a challenge, but we've had several international orders, over the years.
So my last question is how are your kids doing?
Oh, thank you for asking. They're doing well. So my son, Ryan, is 14. My daughter, Haley, is 11. They were, 5 and 8 when Russ went into resident care. And so it's been a journey. I think my son remembers his dad a lot more than my daughter does. And, but it's been a while. I think, COVID was actually a little bit of a blessing in disguise because we weren't able to see him in his facility. And that was when things really got the worst. And so they were kind of spared some of the really difficult times, because dementia is a horrible disease and it's really debilitating. And the end journey is not pretty in any way, shape, or form. And so I kind of made the decision not to bring the kids. So the last time they saw him was right before we put him, right before COVID. So it was February of 2020. And most of the decline was pretty steep after that. So, but they're doing well. They both are great at sports. My son I haven't talked about this much publicly, but my son had his own little bout with Bartonella, and we treated, because of what I learned with Russ, we treated with all botanicals and herbal therapies, and he did beautifully. And so, I'm very thankful for that, because it's a journey. I would have never even known that was something I should screen for if I hadn't been on Russ's journey. And so there's silver lining blessings, because I think that if I hadn't figured that out and had that experience, he might have been suffering for quite some time, like some of the other kids that we hear of in our diagnostic work. And so, and
if there's a genetic component to not from Russ with regards to Alzheimer's, because you actually described it, I think, really well in your book, because it was Dr. Bredesen that I think you read his book, was that, Alzheimer's isn't the disease, it's a manifestation of this underlying dysfunction and problem, and it can manifest in various ways, but that's sort of the end result. But if there is some sort of genetic predisposition to not a disease state, but tendencies, I see this quite a bit with the autistic kids I work with. I'm noticing a pattern that many of these kids have variants that affect their immune system with regards to pro-inflammatory compounds, and that then trigger within the brain. So, there may be some of that there. Obviously, there's much more to know. So I'm happy to hear he's doing well and Haley's doing well. One last question. Is he playing basketball, and are you coaching him?
My son, he stopped, but he tells me he might try out for his high school team next year. And my daughter still plays. I actually coach her in her AAU team and so my coaching career is still ongoing. And we love it. And since I'm a Duke person, we had a lot of fun with the tournament this year until the end.
Well, you've had a good run. I actually coached my daughter in basketball for a couple of years back in middle school, and it was so much fun. Much fun. So, hey, Nicole, thank you so much for joining us on this podcast. I know the book was extremely difficult to write, but it was beautifully written, and it's very honest and open and revealing. And I really would encourage people to get it. We'll be profiling it, off our website and the homepage or the webpage for this podcast. But again, keep up the great work, and looking forward to having another conversation with you down the road.
Great. I would love that. And thank you so much for having me today. It's been great.
All right. Thank you.
You've been listening to the Functional Medicine Doc Talk podcast with Dr. Kurt Woeller. For more information about this podcast, go to functionalmedicinedoctalk.com.